We got information from a reliable source that your non-for-profit High Alert is working to rebuild protective respirators to help cope with the nationwide shortage of protective equipment. These is essential medical equipment for people on the front line. Can you please tell us more about that?
Yes, the High Alert Institute took a look at the fact that PPE was going to run out, personal protective equipment was going to run out. The National Strategic Stockpile, as I said, is a limited resource. We're already out of masks that can be shared, and we're down to only those masks that are needed for federal healthcare workers. That means that there would be shortages down the line, down the supply chain, through the hospitals and to essential workers in grocery stores, truckers, people preparing food and delivering products. One source that we identified was something called emergency escape respirators. Now these are filter devices, powered filter devices or PAPRs, that pull air through a filter canister, kind of like a gas mask, but you wear it on your waist, and it blows air into a hood. And it's designed to allow you to escape a chemical plant or a nuclear plant in the event of an accident. OSHA requires that all these facilities in your communities have them, and they sit in a box on a shelf until there is that emergency. In this kind of a pandemic, OSHA gives a waiver, and you can donate them to the healthcare. So we're going to show you how to refresh a PAPR canister, how to autoclave a PAPR canister, and how to convert those single-use units into a rechargeable, reusable, cleanable ventilator hood, just like the ones you see on television on the nightly news, for frontline healthcare workers to use. Now, how does that help the people down the line in the other places in the hospital or in the grocery stores? Well, if the people on the front line aren't burning through masks at the rate of 1 million a day nationwide because they're wearing a reusable hood, that's 1 million more masks available every day for everybody else who's an essential worker in the United States, whether that's healthcare or on the road or in the grocery store or delivering to your home. So what we're going to do today is we're going to show you folks how you rehabilitate or refresh a single-use emergency respirator. We're actually going to turn this into a healthcare PAPR. Now, just like a regular healthcare powered respirator or filter, they come with these filter cartridges that screw into an air pump. These cartridges come either in plastic or steel. Now, the nice thing about the steel ones like this one is that as long as it is not a chemical protection canister, you can autoclave these just like you would autoclave surgical instruments. And once the stripes are on your autoclave tape, the inside is sterilized again. It's been refreshed. Now, one of the big questions is, well, how do I know when I've done that too many times? It's actually very simple. When you screw this in and you put one on the other side and you turn it on, no air will come out because they'll be plugged when they're dead. Now, normally these last for 40 hours and then they're disposed of. But if you autoclave them, you can reutilize them. And experts disagree on whether you can do them 5 or 10 times, but that's 400 hours of added filtration time. That's a lot of shifts. So that's autoclave refreshing. So you can take a can opener, and I think we have a can opener in the box. And I've cheated. I've already pre-opened this one because I didn't want to have to clean up the activated charcoal that's usually inside. But you can take a can opener and you just open it up like you would a can of sardines or a can of tuna. Once you're inside, you will find some activated charcoal like in your fish tank inside here, and you just throw that away. If you've used this canister before, make sure you're wearing gloves because that will be part of the filter that has been contaminated, so it will have COVID-19 in it. But dispose of that appropriately. And now you have a canister that is ready to refresh. So the first thing that you're going to do is take the top of it and draw some circles on a HEPA quality vacuum filter, shop vac filter. Now, do not try to make a face mask out of this material because you will not be able to breathe through it. Right? HEPA filters are designed to be very tight. They only allow a 0.5 micron, which is smaller than a virus, go through. And we are going to be using an air pump to suck air through that filter, through several layers of that filter, in fact. But once we have this open, and cleaned out, we're going to take some gauze, and as Allison cuts us out some circles of filter material, and she had already was kind enough to cut us a few so that we didn't have to watch her cut forever, we're going to place a little bit of gauze in. Now the gauze is not being used as a filter. The gauze is taking up the space that the activated charcoal used to take up. Right? And then we're going to be placing 8 layers of this material. Why 8? For every 2 layers of 0.5 micron HEPA filter vacuum bag, you get roughly an N70 quality of filtration. So 2 layers, N70. 4 layers is approximately N90. I need 4 more layers to make it to N99, which is what this filter was originally. Now, a lot of people say, what is, and that's 4 layers because she's cutting through 2 layers simultaneously. She's cutting through the entire bag. So now you can see we're set here. And I'll put the top on. And then we get the disaster responder's favorite tool, duct tape, because we're going to duct tape this closed. And we want to make sure that we have a nice airtight seal all the way around, because we are going to be sucking through this filter canister. We're going to suck air in this side. It's going to come out here into our pump. And since we have 1 refreshed canister now, and we have 1 new canister, and we could have had 2 refreshed canisters, now our single-use powered air respirator, or PAPR, is ready to go. All it needs is power. Now these emergency escape PAPRs come with a single-use 10-hour battery that snaps on, that comes with nice pretty cartoon instructions. I'm not going to show you how that works, because once this is dead, these are usually disposed of. But in the healthcare setting now, we need these, because we're out of N95 masks in the national stockpile. We're out of PAPRs in the national stockpile. What can be done is you can take the light battery out of your emergency exit lights. And you do have to do a little bit of wiring, and I prepped 1 wire in advance. And you just have to get a wire that fits whatever type of PAPR plug you have. Cut off the other side. And I'm doing one just so that you can see. Strip the wire. And your bioengineering department at your hospital will have all of these parts. Get a little tab here so that it'll fit on the battery. Different batteries have different tabs. That's why there's a whole little canister of them. And you pop that on, squeeze it down. There are special tools for this, but I use a pair of pliers just to show you that you don't even need the special tools. And you're going to hear this thing come to life. And this is now pushing air. So I'm going to turn it off for just a second, because my power cord is my switch. I'm going to hook it up. Now that it's pushing air, it's been tested, so it's ready to hook up. I can set it up with a belt. I can duct tape my new battery to the belt. Can't wear your glasses in the hood very easily, although a lot of people do. And I brought the mic in with me because now I'm protected. I have N99 equivalent filtration, and I'll be able to go for my whole 12-hour shift on this battery. The better thing is that somebody else's battery is back in that light charging during my shift. So when my shift is over, this hood can be cleaned. So we'll take that off. And as I said, these are good for 40 hours, whether it's refreshed or autoclaved. And the nice thing is, when you've autoclaved this to the point where it plugs up, you can cut it open and refresh it with the HEPA filtration. And again, 8 total layers, and the gauze to make certain that you keep the filters up against the screw end of the PAPR. Now, this is important because your healthcare workers need to feel safe. And while you can share this between people, the ideal is that you get enough of them, of course, that this one's mine. And I will be responsible for cleaning it, and I'll bring it back to shift on my next shift. Sometimes that doesn't work. The other question we get is, well, where do you get these? This is where your community can contribute to your healthcare. There are industrial sites There are sites that deal with chemicals. There are sites that deal with fine particles and dusts and paints that have these emergency and single-use respirator hoods sitting in a box because OSHA requires it. Usually they have enough for the entire shift of workers at their site. If it's a large factory or a large chemical plant, that can be hundreds of these PAPRs. And they could donate those to local health care. The bioengineering department can do this just as fast as a doctor can, probably faster. And every frontline person at the hospital receiving that gift now is protected. More importantly, they're not drawing down on those N95 masks that are so precious and so hard to get, which means there are more masks in the community for other essential workers. And that's the reason that we spent the time to figure out how this could be done, how it could be done safely, and apply our hazmat experience to this problem.